Quite.
good morning, good afternoon, world. So we are back again. So welcome to the JL Health Consult. Uh, if you are here, please can you come know that they are starting already. Oh,
Are we having some people joining us? We've had so
uh,
how are we doing? Are we
okay. So we need to have some people join us already. We do the introduction, and there we go.
I think your the network was quite bad. Um so I couldn't hear you most parts of that.
All right. So you're welcome, everybody. Today is the grand finale of this wonderful drug safety webinar, and it's been an accelerating session for the past 2 days. So today we will have a session on how we can experience safety or ride onto safety while we're taking our regular medications. I do tell people that taking a prescribed medication doesn't guarantee that you are safe, right? And the questions that always been arising that we think that if you are prescribed a medication by a doctor or a consultant and that is all, you just go home, take your medication, and you are good to go. Well, we are not by any means scaring you, but let's look at some principles that you must observe in order to stay safe and not to jeopardize your health, even when you're taking a regular prescribed medication being supervised by a healthcare facility. So today we have our medicine expert with us in the house. Um, I'm very sure that you are willing to see him. Those that came earlier must have seen him. That was an expo. That was an expo. I shouldn't have reviewed him yet, but all right, let's say that was an expo. But we have our able pharmacist right here with us in the house. Um, Pharmacist Desedum Quincy Ndeori,
That is
who
it.
is a practitioner in the UK, and he has stayed over there for over a decade, going to 2 decades. He is an authority in this field. As one of the regional leaders of a rapidly growing independent pharmacy chain in the UK, pharmacist Quincy and his analyst 2019. That was great pharmacist, exceptional is for him to spearhead an innovative and successful pharmacy-led vaccination program. All of us, we were aware of the COVID-19 pandemic, and this great leader spearheaded this pharmacy-led vaccination program with an impressive capacity of over 520 patients. We are here in Nigeria. Some facilities could not even have as much as 100 persons per day when the pandemic was on the rampage. But here is a practitioner that moved the waves of time and was attending to over 520 patients per day in the UK during the pandemic. That have been for free. We have been for free, and for some reasons, I will not say what I wanted to say, but for opportunity, you might likely pay heavily to have him talk to you. But he has generously made himself available to speak to us this night on how to get ourselves free from drug hazards of our regular prescribed medication. Let's welcome pharmacist Desidum Quincy Ndeori, the exceptional pharmacist. Welcome, sir.
Thank you. Okay, so that is actually one of the heaviest introduction I've ever received. Um, very grateful for the accolades that you've described. I'm very humbled by them as well. And one of the things that I have to say is to thank you, my brother and colleague, for everything you're doing and for putting this webinar together. It is something that I feel is very important. It's something that I feel that will engage the mind of several people that are listening. So I have to thank everyone that is listening, everyone that has left. I know most people must have gone to church today to leave their different things and join us today to listen to what we have to say. I have to thank all of you. But most important, as I said earlier, I have to thank my brother for putting this together.
You're welcome,
You
sir.
are yes, you have obviously described me with some very good words that touched my heart, and I'm very grateful for that. So
You're
me,
welcome.
yes, so me saying my name now, which I will briefly just introduce myself as well for those people that might not have heard. So my name is Desidum Nate Quincy Linebari Ndiori.
Wow.
I'm a full Nigerian, and I'm from River State, from Egoni boy, a proper Kani boy to the core. Yes, a
Wow,
proper Kani
wow,
boy.
wow.
And for those of you that might be listening, because I know so many people are listening from different parts of the world, I grew up in
Yeah.
Nigeria. I grew up in Nigeria till I was about 19 years old before I left to England. And I have a very huge depth of knowledge in medicine and in healthcare because while in Nigeria, I started in medicine. Then when I got to England, I studied pharmacy. And I've practiced in hospital, community pharmacy in the NHS. I've gone into industry. I've led so many development sectors across England and ensured that the local community have access to either medication, drug safety, and as my brother mentioned, I spearheaded. Obviously, I'm very proud of it. To have to say, during the COVID vaccine, we were able to build a team that did almost 600 vaccine a day for a period of almost a year. So
Wow.
we have one of the record of doing one of the biggest COVID vaccine across England. So that is me. So I'm hoping that today, by the time we finish, because I'm very passionate about this, I will explain to you how this will go. So I've done the introduction. I will speak about obviously understanding medication, drugs, and which most people call drugs. And I'll make reference from my experience here in England and also my experience growing up in Nigeria. And I believe that will be able to help so many people to have a clear understanding of what we are speaking about. And I will speak about some dangers of not adhering to medication that has been prescribed by your doctor or the ones that you are able to buy from your community pharmacy as well. Then I will move on to giving you some advice on what I believe that you should do before going to take medication. It could be before going to get prescription from your doctors or your pharmacy. and what you should do when you're already taking those medications to ensure safety, and then what you should do after taking those medications. But I won't stop there. I don't plan to stop there. The most important part I am very passionate about is that I'll be able to give you some top advice on what I believe that you should do as an individual. I'll be able to give advice to some of our pharmacist friends, including my colleague that is my colleague and brother, what I believe that
Yeah.
pharmacists across all level, whether in local community pharmacy, in the national hospitals, and across Nigeria and across the world, what I believe pharmacists should do to ensure drug safety as well. And then I will give some special cases, which is examples of some of the situations that I've seen. And I believe few of you might be able to learn from that. And I believe those are some of the things that will resonate with you as you go out in the week that is coming. And then I will conclude. After concluding, I believe from what I've been told earlier, we will have about 15 minutes for questions for people to answer. So during, if you have any question as I'm going forward, just drop the questions. No matter how it might be ridiculous, I think is absurd, just drop them. I will pay attention to all of them and make sure I answer them before we conclude. So that is how it's going to go today. So stay with me, and then I will say let us continue. So one of the things I want to start is to look into the importance of drug safety, because my brother, they've had this section, and I've gone backward to listen to all the session they've done. They've spoken they provided some fantastic information across the days. But why is it very important for us to pay attention to drug safety? And there are several things that I will have to share when it comes to that. And I will start by saying, as someone that grew up in Nigeria, and someone that grew up in the village, I will have to say in the village, there are several things that resonate with me when I see drug safety. And I remembered very well, and my brother would remember this. When we were growing up, we don't take drug safety very serious. We don't, in fact, we don't see drug as something that is dangerous. We see drugs as something that our parents or our neighbors normally ask us to go and buy, and we buy and then give it to them, and then they take it or they give it to us and we take it and we are all happy. The sickness goes away. In terms of the side effects that follows it, is something that we are never always educated on. And when I came to UK, and then that was the first time I actually saw that drug safety is something that people pay significant attention to, in ensuring that everyone is aware and they learn about it. And I'll give an instance. So in my experience in clinical practice in England, one of the key things for any software that you're going to use for medication, it must display the side effects, the interaction of any medication that the patient is taking. So say, for example, now you come to the pharmacy and you give me, and I'm about to give you a new medication. The software will tell me every medication that you've had in the last 10 years or more. And then if there is any
Wow.
interaction that is been identified, those will pop up, and it will not let me go forward until I have decided on each of those interactions. Because if I don't decide on them, there is a huge potential side effect that could be major. So those things are very key. We always take. So that was the first time I noticed that yes, this drug safety is something that is being taken seriously in different parts of the world. And is I'm glad, that's the reason I'm very glad that we are sharing this information today. So talking about the different kind of side effects of medication and the dangers or the adverse effects, one of the places I would like to start from is what we call drug interaction. Drug interaction is when you get prescribed a medication. It's a new medication you've not had before, but if you are to define it, is more as to say, after you're taking a medication, what will the effect of those medication, what will happen to the effect if combined with another medication you're taking? And in most cases, not only about medication, it's about the food you're already taking. It could be about with your body. It could be alcohol. So there are several things that any new medication you're about to take will affect when you're already taking. And when it comes to drug interaction, we have very major ones. And the major ones, in some cases, can lead to severe bleeding of the liver. It can lead to, in very hard cases, it can lead to death. We have the moderate one that is serious but not extremely serious, and we have the mild one, which is just a little one. And then we have some cases where we describe as synergy, and synergy is when two different medications come together and give you a greater result. But we will not speak about those today. We will look at how to educate you so that you are able to avoid the major ones and the moderate ones. So I will start by going to drug. So when you get a new medication, this is my advice, because I will try as much as possible to break this down as possible. And if there is anything I'm saying that you do not really understand, I will appeal to you to just drop the questions, and when I continue, I'll be able to answer them. So we have drug to drug interaction. And a typical example of a drug to drug interaction is when you're taking something that's a medication that is called amiodarone. My brother pharmacist will know about this medication. Amiodarone is a medication that is taken for if you have atrial fibrillation or any arrhythmic condition of your heart. Now, this medication has a high interaction, which means it interacts with loads and loads of medication. But the key thing that I want to pass across to you is that amiodarone can stay in your body for 58 days. What that means is that when you stop taking amiodarone, you have about 58 days where whatever you take during that period, it will have effect with amiodarone. For example, if you take something like clarithromycin, which is an antibiotic, some of you might have heard of it. Clarithromycin, it will lead to an increased rate of your heart going up and down. Your heart you'll be noticing a high BP, high heart rate, and loads of other side effects. But you might not be aware, because you might be thinking, okay, amiodarone, or I've taken any medication recently, but because the half life is that long, it will be in your system for a very long time. So that is one of those things I would say someone to pay across to, which is drug to drug interaction, which is what drug can I take that will affect other subsequent drug I'll be taking. Now, the second one as well is drug to alcohol. Now, when it comes to alcohol, it's not something that as pharmacists we always encourage people to take. But when it comes to drug safety, it's something I'm very particular about, for people to understand that taking any medication with alcohol has a significant side effect that can be considered as an adverse effect that will affect you. And I will give another example for this as well. The reason why I like giving examples is because hopefully you'll be able to remember these medication as we go forward, to say, yes, these are key things. Um, anyone that here that you might be aware of medication called metronidazole. Metronidazole in Nigeria, in other parts of the world, is called Flagyl, and is normally given for people that think that they will have stomach pain. But majority that medication, what exactly is used for, it can be used for STI, it can be used for any and some heart complications. So it's a very strong medication. But if you take metronidazole with alcohol, we have something called disulfiram reaction, which is you will end up having a severe issue of you throwing up and you getting very sick. And from my experience, because most of these things I share from experience that I've had, when imagine going to a pharmacy for your stomach, for that you're having stomach pain, and then you get given Flagyl, and you say, wow, okay, you start taking it, and then you go home, you take the Flagyl, you say, okay, let me drink just a glass of alcohol, and you do, and you notice that you're getting very sick. I've seen situations where the patient then continue to take more Flagyl,
Yeah.
and what they are thinking in their head to say, yes, maybe the reason why this I'm feeling sick is because I'm not taking enough. And then you see that person taking more Flagyl, getting more sick, drinking more alcohol. So those is a classic example of how drug interaction do work. And then obviously the advice to say, whenever you're starting a medication, because of interaction, always ensure you speak to your pharmacist. And when I say speak to your pharmacist is because there are so much dangers that revolves around that medication. And as a pharmacist, one of the things that I always do, because when I started in pharmacy, I've always known that I'm a leader and try to enforce something that people can share among themselves and bring about safety in the community. One of the things I always tell patients to do and pharmacists to do is that when you meet a patient that you're about to give medication to, you advise them to say, yes, this is the medication you're about to take. These are the side effects of this medication. These are the things that you should not do, and these are the things that you should do. These are the life-threatening condition, and these are the things for you to avoid. So from that, I will now move on to telling you about what I believe every person that is watching this should do before starting on a new medication. And when I say everyone that is watching this, for even if you're watching this, I believe you'll be able to write this down and then share with people that your loved ones, share with people around you in a community, to ensure that we have a collective knowledge that everybody understand how to deal with the side effects of medication and medication safety. So let's go forward. So what are the things that I believe that you should do before starting any new medication? One of the things I would advise, number one, is for you to speak to your pharmacist. So if you're about to start a new medication, what I would say you should do, go to your pharmacist and say, yes, these are the medication I'm about to take. Can you please explain to me some of the side effects of this medication? And then write them down. Write those things down that they're saying. And then after then, you then be able to get the medication and then get the information that you've been told and have that for yourself. Then the second thing is for you to follow instruction. I can never overemphasize the importance of you following the instruction of that is being given to you by your pharmacist for you to how to take that medication. Another thing that obviously has to do with the patient information leaflet, which is the information leaflet that is inside of the box of medication. I know in some places across the world, when you are giving medication, you don't get that leaflet, but the chemist or the pharmacist is always aware of the information that is supposed to be there. So always ask. I will emphasize on this. Always ask. You're not doing too much by asking for side effects of the medication that you're taking before going forward. So ask for it, and then when you ask the relevant question, you get the relevant answers that will help you to be able to make the right decision. Then so you ask, how should I take this medication? What else are the things that I need to be aware on this medication? The next question is, okay, if I forget to take this medication, what should I do? And then obviously, when should I stop taking the medication? This is very key, no matter who the person is, especially when stopping medication, because I've seen several situations where you go to the pharmacy or you go to your doctor, they prescribe medication for you, and then once you had that medication, you go home and then you take one, two, or three. After then, you just feel, okay, I'm much better now, I'm going to stop taking the medication. That is one of the major drug safety issue that we have, and it's not only peculiar to Nigeria or any part of the world. It's a universal thing where someone will go to the pharmacy, get some medication, and take it for just a short period of time. So when it comes to medication, you don't just stop. When you're getting the medication, ask the pharmacist, how long should I take it for? When should I stop it? If I forget to take it, what should I do? Should I take double dose? Should I take just a single dose? And now that I'm on this, I will give another example of one patient that I've dealt with when I was, because most time I do virtual consultation with people across around the world, and I had a patient in Nigeria. I believe this was Cross River State, yes, where they consulted me about a blood pressure medication, and then I prescribed a medication for them to take for 1 month. Now, the patient took the medication for 7 days. After taking the medication for 7 days, they noticed that their blood pressure has come down. What they did was that they completely stopped the medication after 7 days. Now, after taking medication for 7 days, the blood pressure come down, they stopped. But what later happened was, after a few days, they measured their blood pressure again, and then it's gone up. What they then did is to go back to the medication and start taking double dose. They took the double dose, and then I believe they rang me after about 21 days to say this is what has happened and the medication has finished. What should they do? It was then I discovered that they've taken double dose, and it was Ramipro. So they were now having significant side effects. And for those of us that are pharmacists, will be aware of the side effects of Ramipro, which has to do with, dry cough. So this patient was having the most severe cough ever because they have now taken a very high dose. And when it comes to medication, if you double the dose, you're having a higher side effect. So this patient has broken, obviously, the advice that they were given, and they are now taking double dose, and they are now having the double side effects. So that is another example of what I believe that you should do to avoid before starting on a medication. The question I believe that you should ask, before taking a medication. Then let's go on to look at what you should do. So now that you've gotten the medication from the pharmacy, what should you do to ensure safety as you're taking that medication? So one of the first thing I will, because what I'm doing now, I'm just remembering some of the issues that I've obviously can share with you guys that help you to understand the severity of what we are discussing today. So when you're taking the medication, one of the things I will always advise patient, I advise this to patient every single time, is when you start that medication, any side effects that you notice, and side effects are things that you experience from the medication when you're taking it that are not desirable for your body. It's not part of the things that we wanted that medication to do, and you will not find them undesirable as well. So before you took the medication, there was the way you were feeling, there was something you expected that medication to do for you. Now when you started that medication and you now start experiencing something completely different, it could be dry cough, it could be diarrhea, it could be severe headache. In those cases, I will always appeal to patients to say, report to your pharmacist. You might be thinking about the bigger picture to say, yes, I won't feel much better. Maybe the reason why I'm going through this. But I will always encourage you to say, report to your pharmacist, report to your doctors to say, yes, these are the things I'm experiencing. Are they normal? What should I do? Should I carry on taking it? Should I do something? Am I taking it according to how I've been asked to take it? And then another thing as well, I will also advise to for patients to also do as well is store your medication properly. And I cannot overemphasize this as well because another key thing that leads to medication safety issue. And I will give another example of this to be an eye drop. Anyone that here have had conjunctivitis, which when we are younger we used to call Apollo in our eyes. So when you get given an eye drop for conjunctivitis, which is called amphenicol eye drop, it is supposed to be in the fridge because of the preservative effects of it. So most people, I know this very well because I've been a victim when I was younger. You would then grab that eye drop, put in your pocket, and then that's it. You're off in the sun. You're gallivanting. You're just putting it straight into your eyes, but not reading on the back of it that says store this in the fridge to be able to use it properly. You need to keep it in the fridge. So that's another key thing I would say. When you're taking any medication, read the storage description to avoid a side effect or to avoid any adverse events that will cause from not storing it properly. So always read what is on the bottle. How should I store it? Where should I keep it? Under what temperature? Obviously I understand that in some parts of the world we might not have an adequate way to store something. So instead of you now worrying that you don't have a fridge, just look for a more cooler part of the house to keep that eye drop, if that would then help. Then so that is another key thing to do when you're taking your medication. Now let's now go into what should you do after taking your medication. So I've discussed what you should do before taking the medication, what you should do during the period of taking medication. And now let's look for what you should do, or let's speak about what you should do after you've completed the course of that medication. And then you've spoken to your pharmacist or your doctor, and they've told you, yes, fantastic, you can now stop, all the medication that you got has finished. What should you do? One of the things I will always advise patients is properly dispose of that medication. The reason for this is very important. So let's say, for example, last year you got medication for headache, and then you finish using it, and then you keep it for a long time, and then it's gone out of date, but you still keep it. There is a high chance that as time goes by, you will then go to that medication and you start putting it straight into your eyes. So once you finish using your medication and it's gone out of date, dispose it properly. in most pharmacies, they always do take out of date medication to be able to dispose it properly. I just got a call. Sorry about that. I had a little bit of distraction. So yes, dispose the medication properly. And then second thing I would say patients should do after you finish your medication is assess the effectiveness of that medication to minimize the amount of double dosing and polypharmacy that you might be experiencing. So let's say you finish taking a medication for headache, and then you are told to take it for 5 days. When you finish that medication, okay, I can see some questions that some comments. I will respond to all of those at the end. So let's say you finish that course of antibiotics, or finish that medication for headache. One of the things I would advise patients to do is give it time where you assess what had just happened. You've taken medication. What then will happen next? You will notice that okay, the headache is on his way out. Don't do anything, just give it a bit of a day or two to see what will happen, because we've seen several situations where a patient will just give a few hours after finishing the medication, and then you will be waiting and then see whether magically your body will just feel much better. There is a period of assessment where you just, you know, calm down and just notice between a day or two, and you will be able to see that effect. So give yourself that time to assess the effectiveness. Then number three thing I would say you should do after you finish taking your medication is follow up on assessment with your pharmacist. You have noticed from this everything I've spoken about, the amount of responsibilities I have given to pharmacists and community leaders and community pharmacists and doctors. I always think that we patients, although I'm a pharmacist in this case, don't use the pharmacies that they have in their local community enough. Whenever you finish a medication, you're just passing where the pharmacy store is. Pop in and then ask them, yes, this medication you gave me, I finished it. It worked wonders. I'm very happy about this. Thank you very much. In when you're doing that, what the pharmacists will do, they will then provide you with more information that will help you going forward. It's very, very key. It's very, very key to build that relationship with your pharmacist and your healthcare providers. Don't just feel like I finished medication. I know this is where the pharmacy is. I'm just going to walk past and never speak to them again until the next time I have another medication. I encourage everyone to have that cordial relationship, concordance relationship with their pharmacist, to say, go back there, do like an assessment, and then follow up with them. Then in the fourth thing, or the third one, I would say we should do once we finish any medication is report any side effect that you are having. This is very key, because over the years I've seen in different forms, and I always emphasize on this because this is a chance for you to hear from a pharmacist, for us to tell you what happens at the background, and hopefully be able to learn from this and then carry it forward to share with other people, to say yes, a pharmacist have mentioned, because we have the data. When you finish medication and you have any side effects, which is when you completely finished it, some medication have a delayed side effect that might come later. So if you now notice that okay, I finished medication, but I notice that my tongue is a bit red, or I finish this medication, I notice some discoloration on my skin, or I finish this medication, I don't feel like my body is the way it used to be, it could be a side effect. If you feel any of those things, nothing stops you to say, I'm going to walk straight into the pharmacy and then discuss and say, excuse me, can you just double check? I've just finished these antibiotics. I've just finished this course of blood pressure medication. You asked me to take it for 1 month. After I finished, I'm dealing with these side effects. How should I progress? If I appeal to everyone to do this, because the pharmacists have a huge resources. They will know someone that has experienced the same thing. They will not share with you, and this will ensure safety for you. So that is the key thing I would like to explain to you when it has to do with after taking medication. Now, one of the my brother and colleague just put that yes, you should report every side effect that you are having to your pharmacist. And in some cases as well, just to mention what and to emphasize on what my brother have just said, what in some cases when you go to the pharmacy and describe a side effect that you've had, I know some very fantastic pharmacists that will not put that note on your record, and they will say, yes, Chief Linebarinjuri, which is my dad, he took this medication, and then he had these side effects. And then what that will happen is that next time when Chief Stevenson Injuri now comes to the pharmacy, they will know that he has side effects to this medication, and he won't be given that medication. That is you taking your responsibility of looking after your health to ensure that there's a continuity of information. Because if you think of it, sometimes you might be having medication. Some days you have it in, if I'm to bring it in England, you're having it in Liverpool, you're having it in London. If it's in Nigeria, you're having it in Can. You have one medication from Kani, another one from Bori, you are having another one in Port Harcourt. So it's up to you now to take responsibility to say, I've had this medication here from this place, from this place, from this place, and I've told the pharmacist about all this information. And hopefully they use their knowledge to give me the best care for me to avoid any adverse effects, which are very, very common. Very common. You will notice this in your community. You notice that someone is taking medication, but you could see them acting a bit somehow. It's side effects of medication. So we should pay attention to this and hope to educate our local community when it has to do with taking medication. Now, this is one of my, I won't call it a favorite part of this presentation because all part is my favorite part. But in terms of top advice, and these advice are coming from my experience, I mentioned to you, because obviously I grew up in Nigeria and I've been in community pharmacy for almost 10 years now. So I'll give some very key advice that I believe that everyone should hold on to. And if you can, just write them down and then you use them across your the time. So I will give advice to general public, and I also give advice to pharmacists as well, because I believe it is a collective responsibility of everyone, absolutely everyone, to ensure drug safety around our community. So one of the key advice, this is very key advice, is that every single person, whether you're a young person, you're an older person, should have a list of medication that they're taking. And what that means is that you might think, oh, these pharmacists know this medication that I've already had. These pharmacists know this medication I already have. But do you know the medication that you just had? You might not. So my advice for you is to have a list. So say when you were, as I keep mentioning, different parts of the world that you might have come from, when you were in Bori, or when you're in Port Harcourt, or when you were in Rumokoro, or when you were in Lagos, or when you were in Abuja, you got this medication. Bring your list or your journal and write. So on the 27th of March 2022, I was given ibuprofen by this pharmacist. You put it on your list. You now travel to Port Harcourt, you're having headache, you were given paracetamol. Write it on that list. Because there are some medication that once it's on your list and you show it to another pharmacist in somewhere in your village when you're there for Christmas, they will notice that, okay, this medication that you're having, you shouldn't be having this one I'm about to give to you. And I promise you, this will save your life. This will literally save your life. Most cases you might not be aware, you might just notice I'm having severe stomach pain after having this. That is drug interaction. That is the drug safety issue that we are dealing with. So this will literally save your life if you can have a clear list of all the medication you're taking. And just to add to this as well, I will encourage you as well. This is just a bonus thing for you to also take responsibility for the older ones, so your parents and your grandparents. Help them to keep a list of the medication they are taking, so that when they go to their pharmacy, they can have just that list to show the pharmacist. Because I know for sure so many older people and some of our elderly our parents, they are going through this as well, but they are not aware. They, every time they are in pain, every time they are going through loads of different things, I am 100% sure that in majority of these cases, is side effects of the medication that they are buying to help them, that they are going through. So these are the things that I would say you should pay attention to. Another thing as well, I would say, another top advice I would say you should focus on is, do not share your medication. I know this is a bit of a, I won't call it controversial. I won't call it controversial because it's a bit cheaper, in this economy that we are in. So most people always feel like, yes, I need to show love by sharing my medication. Unfortunately, you cannot really show love by sharing your medication. There are other ways that you can show love. For example, you can There are so many ways you can think of them, but don't share your medication. The reason is because as a pharmacist, when you give a medication to a patient, you look at the patient directly, and then it helps you to decide. So you're looking at things like age, you're looking at things like their weight, you're looking at things like the demographics of the patient. So everything, you make that choice based on who you see. Now, when that person now take that medication home, and then someone else is having similar thing that they had, they will now say, "Oh yeah, I spoke to a pharmacist a few weeks ago, and they gave me this medication, so now I can give it to you." It's completely different thing. It's a completely different scenario. It's a completely different human being. It's a completely different the is a completely different person that you're dealing with, and what they are having might be completely different from what you had that you presented to the pharmacy. And I've seen cases where that person takes that medication and they've ended up in the hospital, and it led to a completely severe case of adverse event that the person was in hospital for a long time because they just took medication that their mom had. They thought it was similar thing, and then it will be easy to receive love by obviously taking medication that a mom gave to them. Now, and the third thing advice I will give as well is that reusing of medication. When we come to side effects, when we come to the issue of adverse effects, when we come to the issue of medication safety, reusing medication is something that I always advise against. And I'll explain to you what I mean by this, just to make you understand. There are some medication that when you take them now, and then you wait until another few months, and then you want to take the same medication, loads of things might have changed. That is an abuse of medication, because what you've done, you've not gone back to the pharmacist and asked to say, can I still take this medication? In most cases, it might have gone out of date. In other cases, it might have been that you need a different dose depending on the severity of what you're dealing with. In other cases, it could be that you've taken the medication that this medication will now interact with between that short period of time. So reusing it is you ignoring all those possibilities that would have happened and then putting yourself in danger, which is the key thing that I would say you should avoid reusing medication. If you are to, if you're thinking of it, which I keep going back to the issue that it might be too expensive to buy the same medication again, some pharmacies are very lenient. They can say, yes, yes, you've had this medication from us before. You can take it again because what you are dealing with seems like the same thing. So seek that advice. Just to be clear, seek that advice. Then another thing as well, I will have to also add to what we are speaking about as well in terms of top advice is to get familiar with your medication. Most of the people that are here, you might know your shoe size. If someone asks you, I want to buy you a shoe, and what size are you? And you say, I'm size 48, I'm size 49. If they ask you, what medication do you take? You'll be wondering, that's true. I don't know what medication that I take. You should know, because it is your medication. Because when you go to a pharmacy, I believe you pay for your medication, except there are some few of us that might be getting this medication for free. But if you're paying your money, your hard-earned money for it, ask for as much information as possible on that medication, because it will save you. It doesn't save the pharmacist, it saves you. So get as much information that you want from that medication, and then make it yours. Ask for all the information, own it, so that when someone asks you, you could say, yes, I'm taking this medication for this. I'm taking this medication for this, and these are the side effects. If anything happens to me, this is what you should do. Those things will really, really, really do help you. But before going forward, I would like to, because I don't want to forget this point, I would like to speak to some of the pharmacists that are listening, and also other ones that might come across this message later, because I know that what my brother is doing is gonna be huge, and it's something that in the next future we will have almost like a global life and delivery of this message. So this message is for pharmacists. For me personally, I don't know how this does work, but I will encourage pharmacists to provide as much information as possible to patients. When last time I visited Nigeria, I've encountered cases where I went to a pharmacy in Port Harcourt, and then they gave me a medication without a name. And I remember asking the pharmacist to say, what is the name of the medication? She said she knows what it is. So I'm asking, but I need to know the name. And she was telling me that she will not tell me what the medication is, but she knows that it will work for the condition that I was presenting to her. So that is not encouraging. It's something that I believe is not encouraging. I don't know whether is a system that is being practiced in our local community, but I will encourage pharmacists to know that if you educate somebody, you've educated the community. So if you educate that person to say, this medication you're taking is amlodipine, it is for blood pressure. You should take one daily. Don't stop. Come back to me if you can also any information. This is the color of the medication. This is what it looks like. These are other medication. Take that time to interact with that patient, teach them, and I promise you, it changes the way the community relate to medication. Because when that person gets home, that person tells their siblings, that person tells their parents to say, this is what this medication is. And then the next generation that comes will be educated on the same thing. But if we don't do this, we then have a situation where nobody knows the medication they are holding in their hand. And then you are now dealing with something that is a chemical that is very potent, is very active, but the person doesn't know what it is. So they will end up taking it with other things and not knowing how the side effects will work. So I believe that no matter how busy we are, no matter how small the resources will be, as healthcare professional, we should take that step back and educate every single patient that walks into that pharmacy. The reason why they walk in there is because they are going through a lot. They could have just gone to a bar and just use that money to buy something and just dance their troubles away. But they go to a pharmacy, take that responsibility, educate them, and ensure that they get the best information and be able to make choices that are more beneficial for them and the community. So let's go forward and let's look at the other advices that I will now go back to you. I've spoken enough to pharmacists now. So for other people, the next advice is for you to secure your medication. Now you might think, this thing is saying is very easy. I know exactly where I keep my medication. One of the things that I've noticed when people don't secure their medication is that medication gets into the wrong hands. And I cannot overemphasize what a medication for an adult will do to a child when a child takes that medication, because a child medication dose is completely and significantly different from the one of an adult. So whenever you have any medication, make sure you have a place that is quite high where you keep that medication. I've had situation where we've had a child died. In fact, not only one. I think all through my experience, I've had several situations in hospital where we've had several children being rushed to the emergency care. And obviously, in this is a very sad, extreme case of adverse side effects, but always result from us keeping medication in a place that is relatively accessible for to children. And then they will just think, oh yes, this is vitamin C, or this is a lollipop. I'll just swallow it. And then you are dealing with something that just keeping it safe will have helped um, you to avoid. Now, another thing I will also say in terms of advice, this one is a particular one, is about knowing the name of your medication, which my brother pharmacist will be aware is medication sometimes comes in different names. And I have seen several cases where someone is taking two medication that are the same thing and think they are different medication. So we have medication that we say generic name, and we have the brand name. An example of this will be something like clotrimazole, and you have canesten. So canesten is the brand name of clotrimazole, but most people are not aware. And you see someone taking canesten tablets and capsules, and then clotrimazole capsules together. And every pharmacist knows this, that it's a very potent medication. And when you take those two together, there is a high chance, very high chance of you having a high interaction, high side effects, and then high adverse effects that will affect you and affect everything that's around your body. Another example of this I would like to give as well is paracetamol. I think most people always think that paracetamol is the simplest medication that you can ever take. You can pop as many as possible into your stomach, not knowing that paracetamol and the liver are two people that they don't work very well together. When you have so much paracetamol, you're going straight for the liver, and the liver is something that deals with most of our medication. So the more paracetamol you take, the more effect it will have on our liver. But the issue is that there are other medication like cocodamol that also has paracetamol in them. So if you do not seek advice from your pharmacist, you end up realizing, which is this is a very common thing, especially here in England, where you see a patient that says, for the past 2 years, to help my pain, I always take cocodamol and I take paracetamol. Because they think in their head, this one is called cocodamol, this one is called paracetamol. There is no way on earth that they'll be the same. They are actually the same. Cocodamol has paracetamol in them. So that is an overdose that will be going on for a very long time without the patient being aware of them. This is key. And the reason why I said this is key is that on the very least note, you should seek information. You should ask for generic name, ask for brand name, and ask on behalf of your parents, ask on behalf of your loved ones, ask on behalf of your community. Take one step further to protect people. It's not only I'm very passionate about this part because I know it's something that always comes to my head when I think about my local community. You will have someone that is going through a lot, and you will think, maybe I need to take this person to church. And I promise you today, it's side effects of medication that they're already taking. If you pay attention to it, you will realize that it's side effects of medication that is causing this thing that they are experiencing. Now, another advice as well. I have so much advice I want to, but I'm very passionate. I'm looking at the time to ensure that I don't keep you guys waiting for a very long time. Is for you to check reliable sources. And I'm going to put my brother and colleague on the spot now, because I was
Okay.
telling him earlier today before this conversation that I believe that he is a leader in his community. And when I mean that his community is the whole Nigeria, the whole world, and most especially in the local community is where he's in Ogoni, he's in Kani. He is a leader. And as a leader, I'm going to open up his inbox now for anyone. If you have any medication that you want to check anything about, is people that is around that understand medication. People that work in chemists. People that are pharmacists, either on Facebook, on Instagram, or in any social media platform. If you don't have access to some like BNF, like which is we call it pharmacist Bible, where you can get all the information. But anyone that you can speak to that you believe knows about medication, ask them. They should be your reliable plug. If I'm to use that word, reliable plug, you go ask them to say, yes, this medication I'm about to take, please, what do you think? I believe my brother will not, because what he's doing now, he's giving back to the community. So I believe that once he sees that kind of message, he will respond and then guide you. And I can assure you that that will save your life in terms of encouraging adherence and concordance. I just said a word that I'm always very passionate about, which is concordance. And the reason why I like concordance, because it's what I use personally in my practice. Concordance is you, a pharmacist, and a patient agreeing on the course of action, how they will how they will take their medication. And I will encourage every pharmacist to look into it and see how they can apply it. If someone comes to you, don't just say this is for medication, drink, take it all. In my language, when I was younger, my dad used to tell me this. There are some pharmacists that they call Dr. Onle. Anyone from Kani, from here, will understand. Dr. Onle is just like doctors that will say, carry everything you have, pour in a glass of water, and drink it. Take everything. They will not advise you. They will not tell you what they are they ordinary. Just take everything that you have. So my advice for people is seek information from the reliable sources and ensure that you stick to um the the routine and the dose that you've been advised to take. Now, another thing I want to, because I'm trying to look at the time to see how long that I have. But I've spoken about pharmacists educating. I've spoken about people keeping list of their medications, speaking to their pharmacist, reporting problem, taking time, taking your medication on time. These are the key things. You might think, I know all these things, but these are the key things that leads to the adverse effects of medication. Because a typical example, after now I'm going to just give some very few scenarios of what I've personally experienced for you to learn from. But what I would do and now is just to speak about some special consideration. Let me just drink some water. I will speak about some special consideration for everyone, pharmacists, everyone listening. Some things that some people that you should pay attention to, because this is very key. And in our local community, if we throw our mind back, we could see some of these situations and how they've played out. I will advise every single person when it comes to medication. If someone is a child, pay key attention to that person when it comes to medication. It could be that, okay, you said my child is having headache. I had some leftover of paracetamol from last week. Let me give it to them. This is not food. So you cannot give leftover medication. When you a child is experiencing anything, take more care to when you are experiencing anything that needs medication or when you're dealing with medication. If it's a child, their immune system is different, their body composition is different. So pay key attention. Whenever your child is experiencing anything, reduce the effects of your personal natural judgment. Seek expert advice. Immediately your child start taking medication and noticing a bit of side effects, first thing you should do, run to the nearest chemist, run to the nearest pharmacist, speak to the nearest healthcare professional and make it earlier. Put some urgency into it when it's a child. The second one is someone that is pregnant or breastfeeding. Most people might not be aware of this, but most medication goes through breast milk. And when someone is pregnant and they're taking some medication, it passes on to the baby. And it is not it's something that if it's a medication that affects development, you will notice that the child is going through a little bit of more developmental issues, not knowing that it can be traced back to the medication that the mom took when she was breastfeeding or when she was pregnant, and that is a sign of an adverse side effect of medication that you are seeing. So if you see anyone that is pregnant that is about to take a medication, even if they might not be taking the proactive route to speak to a pharmacist, take that collective responsibility, which I have described all through this presentation, for you to say, hold on, you're pregnant. Let me seek guidance before you go forward. Let me find out if this medication will reflect in breast milk. Let me find out if this medication will be good for the baby. Because when you're breastfeeding, you cannot separate yourself from the child. Whatever you do is affecting the child. So that is another special case I want to highlight. Another special case I want to highlight is the elderly, which is our older generation. We that have the privilege to be listening to this seminar that my brother has put together, which is very fantastic. When we've learned something from here, we should go and look after our elderly. It could be our grandparents, it could be our parents. Don't think, yeah, they have one chemist. They have one chemist in the village. They have one chemist in Bore. They have one chemist in Port Harcourt. No, I know there's a chemist in Abiyakuta. They'll be fine. Once you learn something new and the person is elderly, because they at that point they have so many other medication that they're already taken. Apart from that as well, the excretion of these medication is no longer as smooth as when they were younger. So the dose might be different, the adherence might be different, the way they approach this medication might be different. Sometimes they might sleep and forget to take it. So they are the special kind of people that will advise whoever you are. You take that responsibility as someone that is close to them, and then advise them and seek guidance to help them, so that you have a more healthier population of our older of our parents, and that will be our own responsibility. And I will have to obviously advise people. It doesn't have to be that you have to be a pharmacist to take care of your elderly. You can be a pharmacist and take care of your elderly. So that is my advice to everyone listening.
Right. Sorry for the network glitch. Just a moment, and our speaker will be back. And by the way, I trust we are receiving lots of values here today. It is awesome. It is awesome. Um, okay, our speaker is back on stage. Welcome, sir.
Yes, thank you very much. I think
Uh,
I had an issue with my phone because I'm using my phone when my phone fell on the ground and then stopped.
oh, so sorry
Yes,
about that.
it's all right. It's not a problem. I think I'm back now. Let me just set it properly so we can continue.
Uh,
I think I will just hold it. Yes, right. So apologies to everyone. We had a little break that allows everyone to go and have a drink of water because we are almost at the end. So just to and I brought my water as well. So welcome back. And I think we have just very few minutes. So anyone that have any questions that you might have, start typing them because I have very few minutes, and then I will make sure I answer every question that you might have. So when it comes to the top advice, I have just one final one is to pay attention to special medication. And anyone here will know about doxycycline. If you know about doxycycline, then you're a very good pharmacy student. So doxycycline, I remembered very well when I was going to Nigeria, we used doxycycline for prophylaxis of malaria if you're coming from outside the country and you're coming to Nigeria. But it can be used for several things, it can be used for STI. But one of the key things that most people are not always aware of doxycycline is that it's photosensitive. So if you take endoxycycline, you shouldn't go under the sun. And that is one of the things I call special instruction. So when I came to Nigeria few years ago, I took doxycycline. I completely forgot. As a pharmacist, you forget sometimes. And then when I arrived at the airport, I realized I was having severe skin allergies. My skin was literally hurting, and I was wondering what exactly is the problem. Until I realized that I took doxycycline and I was not aware. And one of the things that you never shouldn't do when you're taking the second is walk under the sun, which I completely forgot. So my advice in these cases, medications like that, always ask your pharmacist to say what are the special instruction I should adhere to avoid adverse effects and events of medication. And when these are happening, always know that you should go back to your pharmacist and then speak to them. Now, before I finish, I would like to just touch on some special cases and case studies. The reason why I brought these case studies up is because most people can relate to them, and it will be able to just explain to you some of the things that I personally have dealt with in different places, whether it's in here in England or in Nigeria. And this particular one, the first one was, I used to call it ibuprofen case. And I remember this was in 2022, and I got a call from Port Harcourt where someone told me that they have like an anti-inflammatory injury in their hand, and they are seeking for advice on what medication they should use. And anyone that is a pharmacist here, and most people that are not pharmacists as well, you will know that the best medication to buy over the counter, in as much as we have some that you need prescription like naproxen, is ibuprofen. So I told the patient to say, yes, you should take ibuprofen. It's very good anti-inflammatory medication that will help with the cut that you had. So he went to the nearest chemist. He then bought ibuprofen. But before taking it, I advised them to say, yes, take it after food. It's very key for you to take it after food. But because they were in pain, they just felt like maybe maybe he wants to just be sure that my stomach is filled. That now pharmacists how they do it. So I said no. I was emphasizing, but anyway, the call ended. So obviously that was, and then almost I would say about a few hours later, I got I got a call, and the call was, oh, someone's coming down the phone. And I said, what happened? He said, my stomach. I'm having stomach pain. I'm having stomach pain. I'm having stomach pain. So I asked, what exactly was the problem? Then that he then said that he took the medication and he was having severe stomach pain. But because the medication was for pain, he continued to take more, thinking because he's taking more,
Oh,
yes, because he's taking more,
yeah.
it will help with the pain, which is, it makes sense if you think of it. If you're taking something for pain and one is not working, maybe four will work more, but not in medication. I'll have to advise not in medication. Medication doesn't work that way. One, because one doesn't help, doesn't mean that 10 will help a lot. The reason why they don't ask you to take 10 is because of the side effects. So in this case, this young man, what he has done is that he has not had food. Now he has not taken one. He has taken four ibuprofen, 400 milligram at a time. So number one is an overdose. Number two, his stomach was something else. He literally ended up in UPTH for those that are from Port Harcourt. So he had to be taken, and we had to get a taxi to take him to the hospital. And since then, he's been dealing with stomach ulcer. So that is an example to tell you how side effects of medication is very serious, and adhering to what your pharmacist says is very serious, because you might think they used to think they know too much, but these are from things that we know other patients have experienced. So in this case, that is what happened to the patient. Another one that I will also give as well, this is very close to home, but I will not mention any names, is when it comes to blood pressure. I helped I used to help so many people, and I will advise people that if you have any close relationship with me, you can always message me and ask me for direction on medication. So I advised someone to take medication for blood pressure, and it was amlodipine. And then they started taking it, and then after like few days, they did the measurement. They said, this pharmacist, you're good. Blood pressure is going down. Medication, I don't need it anymore. That's it. We are done. So they stopped taking the medication. The blood pressure went down, and then after a while, the blood pressure went up. With anyone that's a pharmacist will know this, that if you stop blood pressure medication abruptly, your blood pressure will shoot up after a little while. So this happened to this patient, but what they did, they did not call me back because they felt like it's not the medication did not work according to how it should work. So I am the bad pharmacist, not knowing that they did not take the medication according to how I asked them to take it. So that's
Yeah.
another example as well. Just always stick to the medication, and if you want to stop it, seek for guidance from your pharmacist or your healthcare professional or anyone that you can trust. If you cannot afford any of these things that I've mentioned, or you don't have anyone close to you, just take that extra step to seek guidance. And another one as well, which is the final one before I conclude. This one is a personal one. I remembered very well when I was in Nigeria. I used to call myself a medication driver, because my dad would send me to everywhere to go and buy medication. As of then, we had I would call it a personal physician. God bless his soul. One of the a fantastic community leader that was a pharmacist and a doctor for all of us in the village. When I was growing up, and he was a close friend of my dad, a lovely community leader. And one of the things that he knew me personally, because my dad always sent me to go and get medication. I don't know, maybe that's why I ended up being a pharmacist. I don't think so. But when I was growing up, that is what I always keep doing. And I remembered very well, my dad would always send me to go and buy Flagyl every single time. Go and buy Flagyl, Buscopan. For me, I will always remember the conversation he was having when I was younger before he's sending me to go and buy this medication. So if he is having stomach pain, you will say, they said, go and buy Flagyl. So I will run to this lovely man. He will give me Flagyl. I will go home, give it to my dad. He will take it. He will give it to me. But growing up, I never knew what it was. I just felt like it was a medication called Flagyl. So when I then came to England, and by now I have not started studying pharmacy. And I remember I was with my friends, and one of them was having stomach pain. And by the way, this is me as an adult. And immediately he started having the stomach pain. I said, I know medication you should take. Flagyl, go, let's go and buy it. So we went to a chemist and then we are asking to a pharmacy, because here in England is a pharmacy. We went to a pharmacy and we are asking the pharmacist, can we have flagyl? And then the guy was looking at us like, what are these people talking about? I said, no, my friend is having stomach pain. Can we have flagyl? This is me remembering what my dad used to send me to go and buy, not knowing that the medication actually wasn't just flagyl, it is metronidazole. And for those of us that knows, I've spoken about it earlier as well, it's a very strong medication, extremely strong medication. And most times you can use it for infection of the stomach, but majority of the time is used for BV and is used for several heart um, ailment that you might have. So we were insisting, I was telling these pharmacists to say, no, I need flagyl. It's not metronidazole, it's flagyl. I need it for our stomach. And it was then that was I found out that, oh, okay, all this why I had a completely different knowledge and I was sticking by from my own childhood. So it was something that did not denied us, and I went home, I read on it, I realized that, oh, okay, I need to learn more. So the reason why I brought this one as number three is because most of us will relate to it. There are some medication that we knew from our childhood or from our neighbor, or we've heard about it from somewhere, and then we are still taking it up till now. That is, we think that is helping. I want to just give everyone an assignment to say, go back home, research this medication, look for what is actually used for, and if you can, speak to a pharmacist to say, before continuing this medication, please can you let me know if I'm doing something safe? Can you let me know if this medication that my grandfather used to give me, if I can still take it? Especially now that so many people, my brother spoke fantastically yesterday about herbal medication and orthodox medication, everything. So I will advise some of you to go listen to that, and how that obviously have side effects with our normal medication. So those are the things I would say you should do. Look back at some medication you currently think you have the good knowledge about, reassess them, look back at them, and be sure that you're making the right decision in the medication you're taking, and educate yourself. I always believe that as you educate yourself, nobody can then tell you, I won't call it otherwise, but is you now taking responsibility. And then that collective responsibility will then ensure a growth within your own ecosystem, which is you, your brothers, your sisters. And then that is how this change of medication safety starts. It starts from your household, it enters into your community, it enters into the people you know at work. And then before you know it, you are having a more safer public. So in conclusion, because I know I've been speaking for a long time, and I have to thank everyone that has stayed with me. In conclusion, one of the key things I have to emphasize is medication safety is a shared responsibility. It is something that not only for pharmacists, is not something that is only for our older ones, not something that is only for the local governments, for the stakeholders. It is a shared responsibility between ourselves, our healthcare professionals, our stakeholders. And I believe that the moment we continue to educate ourselves and we take it as a part of something that is part of community development, because we have so many people that are suffering these things in our midst. It is true, not only in developing countries, not only in our local environments, even here in England as well. It's something that I see every day, that once we start taking it as a collective responsibility, we end up seeing a situation where, let me I was okay. We end up seeing a situation where there is a more collective effort of everyone to ensure that an initiative is done, that everybody become more healthy, everybody become more aware of how to be more safe. Then the second thing in terms of concluding is obviously taking initiative and ownership, and that is the final one. I would say everyone, as you as a human being, take initiative, take responsibility, and say, this is my medication, this is what I want to do to stay safe. This is what I want to do to avoid adverse effects. And by so doing, we will have a more safer community. You will be more safe. You will live longer. You will be more healthy. My brother will have been someone that's done something more significant for the development of our region, and everyone that is involved, that is listening. So thank you, everyone. for listening, for staying across from beginning to the end. And then what I would do now is to obviously open the floor, and any questions that anyone might have dropped, or any question that you might have, my brother, that you think people might want to know the answer, you can ask me, and I'll be much glad to answer them as honest as possible as a pharmacist. So yes, thank you everyone for listening.
Wow, wow, wow. Thank you so much, our guest speaker, pharmacist Daisy Quincy. I wouldn't be overdoing if I put my hands together for you. I wouldn't be overdoing at all. Wow, wow. I've been schooled today. It's just like I didn't go to pharmacy school at all. But
No, you, no,
I
no, you.
wow, wow, wow. This is a masterpiece. Is a masterpiece, I must say. Please, if you are here, you have to drop something to appreciate our speaker today. This is awesome, and I will advise that you go over this video, share it with everyone
Yeah,
that you care about, even those you don't care about. Please share it. I am a critical minded person, and when I see excellence, I must say that this is excellent, right? Everybody will find this lecture very, very interesting and helpful.
thank you.
All right. Thank you so much, sir. Thank you. We appreciate you. And they say appreciation is an application for more. This is getting me to keep doing this. First of all, I was thinking it was going to be quarterly, something like every 3 months. But with what I'm saying here, my God, we'll talk
What
about that, sir.
I always say, I know we are still on live. Whenever you need me to speak on any of these subjects, I'm always available to speak on any subject, any topic that you might give me. I've explained to you several times. Community development is something I'm very passionate about. So whenever you
Uh,
am getting, I would not hesitate at all.
Okay, that's a privilege to us, sir. Thank you so much. All right, so since I'm speaking, I'm going to ask my own question first. Then we
Okay,
have a couple of questions that I didn't display them so that you don't get distracted. We have some
that's
interesting questions here. Please, if you're yet to drop your question, please also drop it. So my own question is, we are humans and we have this sympathy in us built in, especially those of us from Africa. We know Africa to be our motherland of sympathy. So we have people that are facing pain from whatever source. We something must be causing pain for that pain to emanate. So when it comes to the pharmacy, some of them ask of controlled medication,
okay.
right? I'll ask this on the side of the medication handler. This is going to the public, so I won't just say pharmacists because we have mostly chemists.
Yes.
Well, from chemists in Nigeria and so I will refer to us as medication handlers. So on the part of the patient and on the part of the medication handlers, should we be that sympathetic to hand over controlled medication to these patients, this patient in pain, serious pain, and okay, for those that don't have pain, some of them are having insomnia. They can't sleep at night. And they come sweating, they come telling, pleading with you, please give me this medication. Should we, out of sympathy, give them this medication?
Okay.
And on the side of the patient, is it safe for them to keep consuming this medication without finding solution to what is actually causing the pain? So that is my question, sir.
Okay, my answer to this question is because it is something that I've discussed in several forums with different people, because I like the way you started the question to say we are human, and most people need to not to know that further. In as much as we get guided by rules as pharmacists, we are human, and we do when we see pain, we know pain. So I will answer. I will start the question from the side of the pharmacist, how you should address such a request or demand. So what I'd always say is when a patient comes to you, depending on what they are presenting, if they are presenting me and if it's insomnia, for example, and someone has not slept for a very long time, I always do what I say concordance, which is I will bring the issue to the patient to say, yes, you want medication, and this medication might knock you off, send you to sleep straight away, but there is the issue of dependence that follows medication. And in as much as I'm empathetic and I have that empathy to say, yes, you need to sleep, but what I want you to do is try other means that you want to do, that you might want to, that is sustainable, that will help you to sleep. And because most people, they don't always think of that first. They don't think of that first. They will first of all think medication. So it's now up to our responsibility to say, yes, I see the pain you are going through. I see that you haven't slept. These are the options that you might do that is not directly you using medication. And in some cases, you could see that they are having a completely different shift pattern. It could be that they are going through a lot at home, where they don't their house is not conducive for them to sleep. They are, especially shift pattern is something that makes people not to sleep. So as a pharmacist, most time you don't think of I don't think of medication. So think of the patient holistically. Is there any lifestyle choices that they could adjust that will help them with the sleep? Once they've made those differences, those changes, I've seen situations where they come back and said, wow, 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 this really, really changed my life. And as of that time, they haven't taken any medication. So pharmacy is not in a place where you go and get medication. Once you meet a pharmacist, your life should change, not only with medication, but with information that surrounds that particular topic that might help you without you needing medication. So that is for sleep. And then even if you are to give medication, you should emphasize on the fact that once you use medication, in your head you always feel I need medication. And for example, if someone is like 20 years old or 30 years old, and then you're giving, for example, antihistamine, promethazine, or Nytol that helps them to sleep at the age of 30, by the time they start using that, you and I are aware that the side effect that we follow it up by the time they are 35. So those are the things that you have to look at it holistically and advise the patient accordingly. So most patients, once they hear that okay, there is a dependent issue, they will say, no, 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 I don't want it. I'll go and think of other means to help with sleep. With the issue of pain one, that is a very delicate one. Personally, I feel it's a very delicate subject. And the issue is that when you see pain, I'm always very emotional. Obviously not emotional to the extent that makes me want to carry all the control medication and give it to you. My emotion is more of empathy and allows me to use the resources at my disposal to follow it through. So in my cases, I always follow the ladder of pain, which is what have you taken? You have to engage the patient to find out what they've taken, what is the cause of the pain, and then how sustainable is what you are going to give them. For example, if someone is having severe headache, you cannot decide to give a stronger medication to make that headache go down immediately. If someone is having a cut and you notice that okay, this person is going through severe pain, and they must have heard of a medication called tramadol, they've had a medication called Zomov or something like that from somewhere. That is a controlled medication, but they've never heard of cocodamol. They've never heard of ibuprofen, which is an anti-inflammatory. They've not heard of any other medication that is at the lower end of the ladder that will change their life. So they think they need a greater medication that's on that ladder. So it's still up to that engagement and that concordance and discussing with them. And you will realize that always makes more difference. Because if you give someone the strongest medication that's a controlled drug, where do you go from there? After the pain, after you have that dependence issue, where do you go? So you now have loads of people that after finishing the top medication, they are left with nothing that will help them with that pain. So it is up to our responsibility to manage that expectation within the legal time frame and the legal framework that we have in front of us. And I will advise you, WHO pain ladder is a fantastic one to go with when dealing with patients that are dealing with pain. And in terms of patients, I will always say engage with your pharmacist whenever they are telling you about some of the things that you can do before going for medication. Take that advice very serious, because in the future it will save you loads of money, it will save you loads of dependency, and it will save you loads of abuse. So that is my answer to that question, and I hope you answered the question that you just asked.
Wow, that's up. Thank you so much. Thank you so much. Yeah, that was so much informative. All right. Yes, sir. So I'm gonna display. I think we have two questions here. Let me start with the one from Deborah and Ania. Yeah. So here is the question from Deborah.
Okay, so Deborah said, "Good evening, sir. Please, sir, you said concerning the blood pressure drugs, is it same with other drugs that if you start taking it and you later stop before time, will the sickness become worse?" That's it. This is a fantastic question from Deborah. By the way, thank you very much for asking that questions. The issue is not only blood pressure medication. I think I'll give several instances or several examples. If it is an antibiotics and you take them for 7 days and you stop, you is that is duration of the course, will not have any side effect where you will say the bacteria will get worse, because they call them acute medication. It is supposed to clear that bacteria and then you're good to go. That is an example. If you're dealing with medication for mood, and an example of this could be sertraline, or an example could be citalopram, or you're having amitriptyline, which are medication that helps with your anxiety, help you with your mood, and even the blood pressure one that you've mentioned, Deborah. These medication needs them to have a proper build up in your system before you have a desirable effect. So I will give an example of the sertraline. I know most people might not be aware of this medication, but it takes about 2 weeks before you have a proper build up in your system. Some people can do almost like a month. So you have you starting to take it, and then you haven't gotten that desired effect, and you will stop it, not knowing that it hasn't even started working. So it depends on what medication you're taking. Is the reason why I always emphasize to say speak to your doctor, and they will tell you the duration on how long you should take it. And even when you want to stop it, no matter what medication it is, speak to them again to say, yes, I've been taking this sertraline, I've been taking this amlodipine, bisoprolol, amitriptyline for the past 2 months, but I'm thinking of stopping it. I don't have enough money to continue. How will I do the stopping? There are some cases where when you're stop, you can stop some medication, but you'll be advised on how to stop it. There are some that you need to stop slowly, before, to avoid it becoming worse. That is another one that I want to just mention. You have to stop them slowly, but these are things that you need to speak to your pharmacist about, and then you guys can have a collective discussion how you will be able to stop them. So it differs on medication. There are some medication that is short course you can take for 3 days, something like trimethoprim. 3 days, you're good to go. Amoxicillin, which is a penicillin that most of you might be aware of. 7 days, you're good to go. You can stop it. And amlodipine, which I mentioned, you have to continue until you have a conversation with your medical practitioner. So hopefully that answers your question, Deborah. If not, you can ask more.
All right. All right. Thank you. Thank you, sir.
Problem.
That was Deborah. I believe that you've been settled. All right. So we have another question here from Priscilla Osasenaga. Here is it, sir.
Okay, so Priscilla, by the way, thank you very much for joining. I think I saw you yesterday, you joined as well. So it says, sir, I want to ask for someone that has regular monthly pain and cramps, and you have gone to the pharmacy since I know the drug already, any need to go back to the for next month? This is a delicate question, and I like the way you've asked it. So yes, if you have a particular medication that you've been taking, and if you remember, in one of the things I said throughout this presentation is that for you to take responsibility and know your medication. Once you know the medication, which is the way you've asked, which I like, once you know the medication, you will know what to do, and you know where you get it from, and you know how to refill it. In America, they have something they call refill. In England, we have something they call repeat prescriptions. And what that means is that this person has been on this medication and is going to be on it for the next, I don't know, 1 year. So during that period, you don't need to speak to anyone. They just keep refilling it. So those ones is that patient taking responsibility and understanding that this medication is something that they take for this. Now, if during that period nothing significant has changed. You haven't started any new medication. You haven't started eating a completely brand new food. You've been very posh, a new food has come in. It's only when there has been some dramatic changes, or even if it's not dramatic, that has happened, that is best that we say, okay, go speak to your doctor. But as in your case, you have regular monthly cramps, and then you already know what medication you take. It shows that you are somebody that have taken responsibility to learn about that medication, and you know what you need it for. You don't in that case, I will not advise you to say go back to your pharmacist and say, that cramps from last month have come, because it's monthly thing. So just know how you manage that, and then it is a good way, which is what I was sharing for everybody to do. If you know what you take for something, continue to take it, except something has changed. But once after a while, please speak to your pharmacist to be sure that you are continuing. There could be a newer one formulation in the market that is much better than the one you're already taking. So that is the reason why it might be better for you to speak to your pharmacist after a while. Yes.
All right, Priscilla, I'm sure that you're very much okay with the answer, and it was really helpful. All right, so sir, there is an expression from ASEAN Nixing.
Okay.
Yeah, is an expression. I don't know if he really wanted it to be a question, but I would love you to throw more light on this, because as a pharmacist that we are, and we know that this is a problem. This is a
Okay.
problem. So kindly check the expression, sir, and then throw more light on this.
Asia man. Okay. So I'm glad that he is part of it. He's a fantastic nurse, and I'm glad that he's part of us. So he said nowadays some person, especially youth, abuses some medication based on its side effects. Okay, okay. Now this is a key one. As you rightly said, I will throw more light on it. I'll throw more light on it. And for those that are not aware of what this question is about, there are some medication that even in their clinical usage, they are being used based on their side effects. And I have so many examples that I can. There's minoxidil, which for those that are aware, they use it for hair growth, but that is
Yeah.
the side of it. I could go ahead to There are some Parkinson's medication that some people use for to increase their chance of giving birth. So these are things that have always been done, from years, but until so what later happened in, I think, in the early 60s, was that pharmacists and drug manufacturers start tweaking these medication and make the use the side effects. If that anyone understand, and if that makes sense. So there's some medication where they've removed it from what they were trying to use it for, and now make the side effects the actual uses. But when it comes to other people that are now using that side effect, unauthorized side effect, as what they will use it for, like some youth are abusing medication, is a no-no. The reason why I say no is that you are using the trouble that the medication is giving you as your normal day-to-day thing that you'll be doing. And that is very, very dangerous. It's very, very dangerous, because what you're doing there, you're accepting the trouble in your body because there is a particular feeling that it gives you. What would then happen is that in the next few years, the build-up of that medication that you will have is not for the purpose of what you were treating it, what you're supposed to do. Is based on that side effect. So you have a chronological increase in that danger in your body that will lead to more severe side effects in the future. So it's not something I will encourage at all. I know so many examples which I don't want to obviously to give, because it's not something I encourage, but people using side effects to or abusing side effects of a medication is not something that is allowed. And so many people, they do it, but it's something I would not advise anyone to do. So yes, I think, just as a brief comment, I think this particular topic is a full topic that at one point we can discuss, and then I'll be able to throw more light on it. But today, just
Oh,
throw lots a little
okay.
advice on it.
No,
Yes.
noted, sir. Noted. Yeah, it's a full topic. It's a full topic. I'll take a note of that. So we have a full question now by Azia Nixon, our amiable nurse.
Okay. Okay. So he said, as healthcare providers, are we to explain the side effects of medication to patient and users? But what about situation where patient tends to abuse certain medication based on pleasurable effect. Now, this particular question is very key, and I will explain what personally think. I think most times when as healthcare professional, one of the things that we should look at is we should carry a holistic approach to dealing with issues. And what I mean by that is to think about the ratio of people that will be safe from knowing the side effects of this medication to the ratio of people that will abuse that information. And you will always, in a good, if you want to develop the society, you will always end up knowing that there are more people that will make good use of this information than the people that will use in a bad way. So there is absolutely no way you can control, but you have to do due diligence as a healthcare professional to ensure that you provide that information to every single person that walks into your pharmacy or to your hospital. Provide the information for them. You might, in your you projecting to think, maybe they might use it for something bad, is up to them, but you've provided that information. Some people might think they want to use it bad, but after you provided that information, they will think twice. But the main thing I'm emphasizing on is that majority of people will gain from it. And a typical example is the story I gave about flagyl when I was growing up. If at one point my dad was told to say, yes, this medication is this and that, and these are the side effects, that will be passed across to me, and then I will pass that across to other people if I wasn't a pharmacist. So, as healthcare professional, I would believe we should explain medication to patients. We should tell them what medication we are giving to them, so that we don't have to keep on, speaking to them, so that the community will be able to grow that way, because you are passing the information. And that's the reason why you went to pharmacy school for 5 years or went to nursing school for this number of years, is for you to educate the public, not to withhold information based on some information that you must have heard, which is very few people. And this thing always happen. It's very few people that might be doing it, but you have that legal and clinical responsibility to the community to provide that information as honest as possible. And I promise you, as the young people grow and they are aware of it, they'll be able to make changes that in the future you will see a development trend that is coming up where people are more aware of their medication and they are avoiding adverse effects. So that is my take on that. In terms of what I should provide, I always provide to them no matter who the person is, and they will be able to make right judgment in most cases. And I hope that answers that question, my brother.
Very sure, very sure, very sure about that. It does. Wow. Okay, let me check if there are some other questions.
Okay.
All right. So this this is so apt. I've taken note of so many things that you mentioned that we need to put into a lot of consideration as we move on. So this is fine. Thank you so much, sir, for being of great advantage to us here on this platform. We hope to have you more often. And when I mean more often, I mean that. So more often. All right. So Priscilla, thank you for asking questions. Deborah, thank you so much. Asian Exen, our nurse, thank you. Thank you
That's it.
for asking the question. And for everyone that participated, the Greenwood Citizen, Email Blessing, Deborah, Priscilla, I could see our very big brother here, our very big brother, Doolo Agara. I am so happy that he joined us, and he said the lecture was very informative and was thanking our speaker for coming through with the wealth of knowledge and experience. Thank you so much. Here is me thanking everyone for participating and urging you to please share this video. We'll be doing some bits and sharing on other platforms, and we redirect them to this to have a full scale of what we have done here today. I am so happy to be part of this. I'm so happy. And
Okay.
once again, our exceptional pharmacist Quincy, all the way from the UK, thank you for joining us.
Thank you
Pray
very
that
much. And thank you. Before I go, I will encourage everyone to say,
okay.
to when I see a good thing, I like to support, and I will encourage everyone to please subscribe, please share. If you have two accounts, subscribe with both of them. put your notification so that anytime when we are able to do another of this, you will be able to be the first person to hear. And then share on all platforms, on Instagram, on Facebook, on Twitter, on To Go, everything that you use, share it. And then we'll be able to share this knowledge. By the grace of God, in the nearest future, medication safety and adverse effects will be something that everybody in our community and in various communities, it doesn't have to be anywhere you are, you can share with everybody, and we'll be able to have a collective development across all platforms. So thank you, everyone. I'm very grateful for my brother for allowing me to have this speak today, and I'll hopefully be able to do it again. Thank you.
All right. Thank you very much. Do
Thank
have
you,
a great
everyone.
night and
Have
a
a good
great
evening,
stay.
everyone. Bye.
Bye.